Welcome to the deep dive. Today we're tackling something really common, osteoarthritis of the knee.
Yep, very common.
Mhm.
Probably the most frequent type of knee arthritis people encounter.
Exactly. And understanding it is, well, pretty crucial for anyone getting to grips with musculoskeletal health.
Oh, sure.
So our mission today is basically to pull out the really key high-yield info from some revision notes. Think of it as a quick, effective overview definition, causes, management, the lot.
Sounds good. A solid revision blast. So, where should we start? Definition.
Yeah, let's nail that down first. What is knee osteoarthritis in simple terms?
Okay. So think of the cartilage in your knee as a smooth cushion. Osteoarthritis is basically when that cushion starts to wear down, it degenerates.
Right, wear and tear.
Exactly. And that breakdown leads to things like pain, stiffness, and, just generally makes it harder to use your knee properly. Functional limits.
Okay, so what causes this wear and tear to happen? What are the main culprits?
Well, there isn't usually one single cause. It's often a mix. Aging itself is a big factor, just years of use.
Makes sense.
Then there's previous joint injury or trauma. If you've damaged your knee before, your risk goes up. Obesity is another major one that extra weight really stresses the joints. And also repetitive stress. Think certain jobs or even sports that put constant strain on the knees.
Are there specific things that makes someone, more likely to get it, like risk factors we can list?
Definitely. So advancing age, as we said. Obesity is a big hitter. Previous knee injury or surgery is key.
Okay.
That repetitive joint stress from occupations or sports. Genetics can play a part too, can run in families.
Right.
And sometimes other medical conditions like rheumatoid arthritis, for example, can increase the risk as well.
Gotcha. There was a memory tip for that, wasn't there? AOPRGM.
Yeah, that's a good one. Age, obesity, previous injury, repetitive stress, genetics, medical conditions. AOPRGM helps keep them straight.
Handy. Okay, so that's the why. What's actually going on inside the knee joint? The pathophysiology.
So it's this progressive process. The cartilage thins out, it breaks down, sometimes right down to the bone underneath.
Ouch.
Yeah. And the body reacts. You get inflammation. You can get these bony growths forming around the edge of the joint. They're called osteophytes.
Bone spurs.
Exactly, bone spurs. And even the bone itself under the cartilage can change, remodel. The joint lining, the synovium can get inflamed too. Ligaments might be affected. It's a whole joint issue, really.
Okay, so if someone comes in with knee pain, how do you tell if it's osteoarthritis versus, say, something else? What are the differentials?
Good question. You've got to rule out other things. Other kinds of arthritis, definitely like rheumatoid arthritis, which is more inflammatory.
Right.
Gout can affect the knee. Then there are more acute things, like traumatic injuries, maybe a meniscus tear or a ligament tear. You look at the history, the pattern of the pain, the examination.
To piece it together.
Exactly, to differentiate.
And how common is this in the UK? Are we talking a lot of people?
Oh, yeah. It's very prevalent, especially as people get older. The stats suggest around a third, maybe 33%, of people over 45 in the UK have symptomatic knee OA.
Wow, a third.
Yep. And it gets more common with age, and it does tend to affect women a bit more than men.
So what would someone typically notice? What are the classic symptoms, especially in someone, say, over 50?
The main things are joint pain, obviously.
Yeah.
Stiffness is a big one, particularly after you've been sitting for a while or first thing in the morning.
Morning stiffness, okay.
Reduced range of motion, finding it hard to bend or straighten the knee fully, sometimes swelling, and often a noise like a grinding or popping sound when they move the knee. That's crepitus.
Right, that grating feeling. And what tends to make it worse?
Activities that load the joint. So walking, climbing stairs, even just standing for a long time can really flare it up. The pain can be quite severe sometimes, but it might come and go. It's often intermittent.
Okay, so if you suspect knee OA based on these symptoms, what investigations would you do?
Well, usually the first step is a plain x-ray of the knee.
What does that show?
It's good for looking at the bones. You look for narrowing of the joint space. That gap between the bones getting smaller tells you cartilage is being lost. You can also spot those osteophytes, the bone spurs. Quick memory tip, x-ray for the bone changes.
Got it. What about MRI?
MRI gives much more detail. It shows every kind of cartilage, ligaments, meniscus, bone marrow. It's really useful if the diagnosis isn't clear from the x-ray, or if you suspect something else is going on, like a meniscal tear. So MRI for more detail.
Makes sense. Okay, so someone gets the diagnosis. What happens next? How is it managed?
Right, management. The main goals are pretty straightforward. Relieve the pain, improve how the knee works the function, and generally boost the person's quality of life.
And how do you achieve that?
It's usually a combination approach.
Hmm.
Non-drug methods are really important. Things like specific exercises to strengthen the muscles around the knee. Weight management is crucial if someone's overweight.
Physical therapy, too.
Absolutely. Physical therapy is key for improving flexibility, strength, and movement patterns.
What about medications or other aids?
Yeah, pharmacological options include analgesics, pain relief like paracetamol or NSAIDs, anti-inflammatories if needed, sometimes creams or gels.
Okay.
And assistive devices can make a big difference. Knee braces for support, or using a walking stick or cane to offload the joint.
And surgery.
Surgery is usually reserved for severe cases when other treatments haven't worked well enough. The main option there is joint replacement, either partial or total.
Okay. What about the long-term picture, the prognosis, and are there complications?
The outlook, the prognosis, it really varies. It depends on how severe it is to start with, how old the person is, other health issues, and critically, how well it's managed.
Right.
With good management exercise, weight control, appropriate pain relief, many people can manage their symptoms well and slow down the progression. But complications can happen.
Like what?
Well, the joint can become deformed over time. Mobility can become increasingly limited, which obviously impacts quality of life quite significantly. And of course, if surgery is needed, any surgery carries its own risks.
So a real mix of things to consider there. We've covered quite a bit: the definition, causes, risk factors, what's happening in the joint, how it presents, diagnosis, management. Quite a deep dive.
Yeah, covered the essentials. It really highlights how much osteoarthritis can impact people.
It really does. And it makes you think, doesn't it? Given how common it is,
Yeah.
what lifestyle changes could people realistically make now that might be most effective in maybe not preventing it entirely, but mitigating the risk or slowing it down if it starts?
That's a great question for everyone to ponder. Proactive steps.
Definitely food for thought. For anyone listening who wants to dig deeper or needs solid revision resources, do check out passthemsoi.com.
And freeSOA.com as well for more support.
Great resources. Well, that's all we have time for on this deep dive. Thanks for joining us.